Welcome to Humanautic, unlocking the secrets inside your body and brain. Hello Humanauts, welcome back. In today's video, we're diving into one of the most common spine conditions you'll encounter, the slipped disc, also known as a herniated disc, and more importantly, how surgeons fix it step by step. If you're a medical student or surgical trainee, this is going to give you a clear, clinical understanding of the procedure. What is a slipped disc? Let's start with the basics. The spine is made up of vertebrae, and between them are intervertebral discs, which act as shock absorbers. Each disc has a soft inner core called the nucleus pulposus, a tough outer ring called the annulus fibrosus. A slipped disc happens when the nucleus pulposus pushes out through a tear in the annulus fibrosus. This can compress nearby nerves, leading to severe back pain, radiating leg pain, sciatica, numbness or tingling, muscle weakness. When is surgery needed? Not every slipped disc needs surgery. Most cases are treated conservatively with rest, physiotherapy, medications. However, surgery is indicated when there is persistent pain despite 6 to 8 weeks of treatment, progressive neurological deficits, severe nerve compression, or emergency conditions like cauda equina syndrome. Types of surgery. The most common surgical procedure is discectomy, removal of the herniated portion of the disc. This can be done as open discectomy, microdiscectomy, minimally invasive, most common today. Other procedures include laminectomy, removal of part of the vertebral bone to relieve pressure, spinal fusion, joining two vertebrae for stability, in selected cases. Step-by-step surgical procedure. Let's walk through a microdiscectomy, the gold standard procedure. Step 1. Anesthesia and positioning. The patient is placed under general anesthesia and positioned prone. Step 2. Incision. A small incision, usually 2 to 3 centimeters, is made over the affected spinal level. Step 3. Muscle retraction. Paraspinal muscles are gently retracted to expose the vertebra. Step 4. Accessing the spine. A small portion of the lamina may be removed. This is called a laminotomy. Step 5. Nerve root identification. The surgeon carefully identifies and protects the compressed nerve root. Step 6. Removal of herniated disc. The protruding disc material is removed using microsurgical instruments. This immediately relieves pressure on the nerve. Step 7. Hemostasis and closure. Bleeding is controlled, and the incision is closed in layers. Does the heart stop? A common question among students. No, the heart does not stop during spinal surgery. The patient is under general anesthesia, and vital functions are continuously monitored by an anesthesiologist. Recovery and outcome. Recovery is usually quick, especially with minimally invasive techniques. Patients may walk within 24 hours. Pain relief is often immediate. Full recovery takes a few weeks. However, proper rehabilitation and posture correction are essential to prevent recurrence. So Humanauts, that's how surgeons fix a slipped disc, from diagnosis to decompression. If you found this helpful and want more simplified surgical explanations, please like, share, and subscribe to the Humanautic YouTube channel.